Hi, my name is Tina Marie Shea, and I'm here to talk to you about socioeconomic factors and the relationship with adolescent substance use. Socioeconomic factors include one's educational status, employment status, and income. Several studies have examined how one's SES can influence adolescent substance use. Substance use at young ages can have detrimental effects on the developing brain and is associated with a decreased educational attainment. Communities with lower SES tend to be more crime-ridden, have more household dysfunction, and a lack of education. These stressors often become triggers for early adolescent substance use, including alcohol, marijuana, and cocaine. Minorities with a low SES have been found to have a higher likelihood of using marijuana over their lifetime. Economic hardship translates to relationship fractures and additional household stress. When parents are required to work more and are around less to supervise their children, they suffer, resulting in poorer mental health and feelings of emotional neglect, causing some adolescents to turn to substance use. In these communities, there's often less or inadequate access to community recreation centers and parks. Without these healthy outlets, these individuals are more likely to develop a substance use disorder in early adulthood. Financial hardship, an unstable home life, and less parental education have been found to increase drug use in adolescents. Some studies have found that from ages 12 to 15, those with a below average SES were more likely to use illicit drugs compared to those with a higher reported SES. However, among Americans 16 to 19, a higher SES is associated with a greater likelihood to use drugs. Opioid use has grown vastly among adolescents over the last 10 years. As of 2021, a national survey indicated that 21.3% of 12 to 17-year-olds had engaged in illicit drug use. 12.4% of them were opioids. SES is a significant risk factor for using illicit drugs as an adolescent. Low SES positively correlates with greater alcohol, cigarette, and cocaine use among white teenagers. Low parental education and a moderate household income was related to higher reports of smoking among adolescents. A lower SES and a larger family size were contributing factors toward a higher probability of substance use disorders as adolescents grew. Adolescents with college-aged parents were less likely to engage in harmful drinking or illegal drug use. However, the relationship between substance use disorders and SES has been found to be more complex. The rising price of alcohol translates to lower consumption rate in disparaged communities. Thus, adolescents with more disposable income were found to binge drink more frequently and in public. For this reason, studies have found that higher SES in adolescents is correlated with more frequent and intense substance use with binge drinking, marijuana, and cocaine as they enter early adulthood. Maternal education and adolescent drug use has been found to be very closely linked. The higher the mother's education, the less likely her child is to engage in substance use. The correlation is so strong that findings point to educating parents and future parents as preventative aspects of adolescent treatment programs. Lastly, SES has been examined to determine its relationship against treatment outcomes in adolescents with substance use disorders. It's been suspected that people with a lower SES have less access to adequate health care and treatment, but the results were found to be more multifaceted. Implementations of publicly funded treatment programs have decreased the gap in accessible treatment. The results of this study suggested that SES was not a determinant of adolescent treatment or outcomes up to 5 years post-treatment. However, parental education did influence the continuation of 12-step attendance, highlighting the need for adequate parental education.